Thank you. So I'm Nicola, and I work at NHS Digital, and I'm the program lead there for widening digital participation, which is a bit like what it says on the tin. Apologies to those who thought I was coming here today to talk about transforming the whole NHS and that we've solved it and it's all sorted. It's not. I'm just going to talk about a small snippet of the NHS and what we're doing to try and make sure that no one gets left behind as we're kind of hurtling towards this digitized NHS. So it's really important that we're thinking about that. Okay, so what's the problem? So obviously, again, as I just said, you know, we're working towards moving more and more services online, not just for the sake of it, but because it could be of real benefit to people. It offers more choice, and it offers, in some cases, a better user experience. So when we talk about no one getting left behind, we're really focusing on the most excluded, the most vulnerable in society. So what we know is that there's still about 11 million people in the UK who don't have the skills and confidence to be able to do some of these quite complex transactions. And then there's 5 million who've never been online and probably never will be as well. What we're seeing is low levels of adoption even with digitally savvy people in the general population. We're looking at, if we look at personal health records, I mean, awareness of the function of being able to have your personal health records online is only at 5%, and actual usage is down around 1%, so that's a big challenge. The people who are not online tend to be people who have multiple long-term conditions, have very complex health and care needs, and although they're the smallest percentage of the population, they are the largest percentage of cost to the NHS. Also, when we're talking these days about digital, or just about health literacy, digital skills is now part of what that means. So to be health literate means that you should have the skills to go online and access health information and download tools and do all of those things. So yeah, quite a big challenge there. So what are the barriers? Why aren't people going online, accessing digital health information? So the first one there, skills, is probably the biggest assumption that we made over the last couple of years. We've invested a lot of money in skills as the barrier, and you know, we've seen some success in that, but we're still looking at the same numbers of people not online using health information as we were like 4 or 5 years ago. And people always thought the market will look after this, but actually it hasn't. So the next one down is around motivation, and that's really about people not really seeing the benefit. Why me? How is that going to help me? Why do I need it? And that's something that we're really looking into at the moment, and how we can do that, how we can activate and get people involved. And I think that's really about showing them the benefit and showing them how it can improve their lives and all of the things that it can open up to them. Awareness. I mean, people just not knowing that this stuff is available is probably another kind of big barrier that we haven't really kind of looked into a lot. So, as I said, people don't know about personal health records. They don't know that they can, you know, book their prescription online. They can book an appointment online. They don't know all about these cool apps and all of that, and wearables that can help them better manage their conditions. So I think what I didn't say is motivation, I think, is a big thing, because actually if people are motivated and activated, that solves the skills problem. Because if you want to and you're interested and keen, then you're going to go and take that step. The same as awareness. If I know about it, then you know I'm motivated, and that sorts the skills thing out. Access and cost is a bit different. I mean, access could be anything from, you know, just bad connection in my area. I can't download stuff. I can't do a Skype consultation because, you know, it's just impossible. Things like cost, I guess, cost affects young people and homeless people as well, maybe who have a device but, you know, can't afford the data costs. And then the last one here is probably something that's kind of, in the last kind of year or so, has kind of come to our attention, and that's actually all of the above barriers have been sorted. and people are motivated, they've gone online, and then they get to this product, this website, or to download this tool, and they have a really bad experience, a frustrating and awful experience because it's so badly designed and they've had such bad experience. And this, in a normal day-to-day life, that's just, slamming your head against the keyboard and just getting annoyed. But for somebody who's vulnerable, who's really unwell, who maybe has, a mental health problem, this actually means quite a lot to them to have another door kind of closed to them and another frustration. But what we can, so one of the ways that we can solve that is making sure that the products and services that we're designing are co-produced. So collaboration and co-design can improve that experience and obviously widen digital participation. And that's kind of a no-brainer. It's like if you are involving patients, involving staff, involving the community, you're going to have products that are relevant, useful, and used as well. So that's kind of what we want. So we're all about this. This is like, and I'm going to say a lot of the same things actually as you guys have said as well. So we're right. We're getting it right. So this is not, we're not saying that these are the right things to do. This is just what's right for us. And this is what's kind of working for us at the moment. So just a little snapshot of kind of what we're doing. And these apply particularly to some discovery work that we're doing around digital inclusion for vulnerable groups. And they're called Digital Inclusion Pathfinders, but I'll talk a bit more about them in a bit. So focus on needs, a bit obs. But I don't think this can be said enough, and it had to go in there because I was like, oh, people are going to go, really? Okay, so focus on needs, absolutely. Working in partnership with patients, staff, and community experts. I mean, this is it really. So again, I think in the past the NHS have made just massive assumptions, have prescribed, and we know what people want, and it's like, okay, here, go and build that. But that's not what we're doing. We're humble as well. We're not the experts. We're going to go and talk to the experts who are the patients and who are the staff that work with them every day, and also the community people. And there, I think that third sector probably, and that third element is what we don't focus on a lot, because a lot of the care is not just with the NHS, it's with all of the kind of local community and charities that work there as well. One of the things that we do is not roll in and try and do something new. We're going to look and see if there's anything that's there that's working already, and that's what we want to invest in. So if there's something there that's working well, that it's familiar to people, that they know and it's embedded, we want to invest in that and kind of boost the work that they're doing and try and scale it in some way. Go to where they go and work with the people that they see every day. Again, this is kind of, this is really, really working for us at the moment. So a good example of this, we'll talk a bit about later, is that we're doing some work with homeless people. So if you're working with trying to understand the needs of homeless people and what their barriers and challenges are, you got to go where they go. And that literally means, 4 a.m. kind of going out with the teams from a local charity, going to the local shelter, going to the places they're sleeping in, talking to them, chatting with them. Same with young people, same with the older people in rural areas that we're working with. So, and that seems to have worked really well for us. And again, in the NHS, we've never done that. We're like, come to us, here's a shiny thing, come and look at it. But they're like, what? No. And then the last one again is around language, and I guess this particularly is a thing in the NHS, especially when you've got clinicians who are leading on design and designing services. So it's kind of like that internal language and the language of people, and just realizing how alienating that can be when we're using all this kind of complex medical lingo. So kind of shifting away from that is been really hard, but I think people are getting that now, which is really good. Okay, so again, it's exactly what you guys were saying. This is about kind of people and behaviors and getting in, looking at their lives and kind of building stuff around that, and not just about the technology. But this is just a really eloquent way that somebody else said that I would never have come up with, which I think is nice. Okay, so So I just wanted to give you a couple of examples kind of what we're doing. And I guess one of the best ways to do that was to talk about the work that we're doing on our digital inclusion pathfinders. So Pathfinder is, again, it's an inherited term, I really want to get rid of it, but Pathfinders are kind of like discovery projects or test beds or pilots or trailblazers if you look up in the dictionary. And this is about us, so kind of going into an area so that we use some data, going into an area where we know that there's high need, so high digital exclusion and high health inequality. So we already know that there's problems there. And we want to go in and we want to work locally with the NHS organisations. We want to work with community groups, local council, patients, anybody really who wants to get involved. And actually we asked people to come forward with expressions of interest to say, hey, we're doing some really cool stuff here we could really do with some investment because we've got a bit of money to do that, but also to bring in some expertise and some service designers that can help us do this because we don't have the capability and the resource kind of in there. So we're working with the amazing guys from Good Things Foundation. So if anybody's tweeting that, say I said amazing, because they are amazing. So they're going to work with us to develop 20 of these Pathfinder projects. Again, just about like developing, designing, failing, iterating, and at the end, what we want, at the end of a year, we'll have some kind of model that we know is evidence-based, we know works, and then we can sell that then, and scale that up and hopefully see kind of a massive adoption across the country. That's the dream. Because that's what people want. People want evidence-based solutions, and that's what and there's a lot of fear around that, commissioners, of services, they want the data, and that's what we want to provide for them. All of these are co-designed with patients, staff, any community organizations, or anybody really who's involved. And again, the big thing what we want to do is we want to share all of that insights and learnings, and then we want to and obviously see some kind of scaling and wide adoption of the models that we're going to develop. Okay, so I've got two to show you. So this one is, it's one of our Pathfinder projects. It's in Hastings, which is a small seaside town in the south of England, an area of high deprivation. I don't know why it's fabulous. I don't know why it's a really lovely place, but the levels of homelessness down there are quite staggering. We did a research project with the charity a while back, and they kindly for us, they went around, they spoke to all of the people, so it's homeless people and people at risk as well, talking to them about how they use technology every day. What are the problems? What are the challenges? Are you interested in digital health? How would that help you in your day-to-day lives? And actually the outcome from that was quite amazing, and some of it so surprising. So nearly everyone had a device that was internet enabled, and also that there was a huge appetite for being able to access digital health technology, if you think about it. So one guy was talking about he hated going into the GP surgery to get an appointment because the receptionist was a bit snooty and kind of looked down on him, and he just found it a very depressing experience. So for him, being able to book an appointment online was the result. But also, because of the transit lifestyles as well, being able to have your health records online, and just kind of bringing them along with you and not having to answer the same questions over and over and over again, because again, that's just really depressing to have to do that. So actually, digital health is a real benefit to homeless people, and they really, really were enthusiastic and wanted to get involved. And we actually have some service users who are part of the design group that we're working with. So yeah, we're working with Seaview, the local charity. The CCG is involved, which is fantastic, because we always want CCGs, for people who don't know that, they're like the clinical commissioning groups, and they're the guys who are commissioning these services. And what we're trying to change is that they're commissioning the right services, and they're asking for the right things when they're putting out contracts. Local council, libraries as well. So one of the challenges that homeless people have with getting access in libraries is that often you need a library card to get online, to go in and get online, but actually you need a home address to get a library card. So what we're trying to do is And also you can just use your library card in one area, that you can't travel across the country. So one of the projects we're trying to do is get a universal library card for homeless people who can use it anywhere, but also they can't take out books, but they can access the internet and maybe download some ebooks if they've got a device as well. So that's a really cool project. Sorry, next one. This one I love. This is my baby. So this is number 65, the High Street, and this is like a little pop-up digital hub. So this is like Google Garage, but better. So what we did is this is work. So the theme of this was looking at rural areas, particularly older people in rural areas, and being able to connect them. So it's about reducing isolation, but it's also about them benefiting from digital health technologies as well, so online consultations, that kind of thing. So it's a social prescribing project, so GPs in the area will be prescribing digital interventions, internet stuff, to help people manage their conditions. So then for those who have maybe lack the confidence or the skills or the know-how, they can pop along to number 65, have a cup of coffee, talk to somebody. There's digital champions, volunteers there helping people, and it's been really cool. The response, like the local residents just all kind of came forward to volunteer and help young people. They got the Scouts involved, Age UK, Citizens Advice Bureau. So it's just, it was just a really fantastic example of collaboration. If anybody's down in ALC, pop in. They're really nice and they've got really good coffee. Okay, so actually this really, like, I just couldn't believe that this came out of the words of the mouth of a 19-year-old. So this, I think it sums it up, and it was a quote from a 19-year-old who sat in our Islington Pathfinder design session. So they're young people with mental health, and they were saying, so she said, so the person who knows me doesn't have the knowledge, and the person who has the knowledge doesn't know me. So I think that's it perfectly about bringing those two people together. So the person who knows me and the person who has the knowledge, and I think that's what we're trying to do. Okay, so we're doing it, but we're looking at the challenges of doing this kind of at a wider level across the whole of the NHS. So one of the problems is that there's no standard guidance. So there's no toolkit or thing that people across the NHS can go to kind of see what good looks like and what's best practice. There's great things happening in pockets and local areas, but there's no kind of national thing. But the good news is, and I'll talk about the good news after this, is that there is kind of some stuff happening around that. The second one is probably the big thing. It's like, how can we do this? We're already at full capacity. We can't get any more people. We don't have people who know how to do this. We don't have any money to do this. So we're asking more of people. And I get that, but I think if we can show them the benefits and the savings, the long-term cost savings, I think that's how we can kind of encourage and get people to kind of invest in this way of working. There's a lot of misconceptions and fears around this. So imagine putting the patient in the driving seat. What are patients going to expect? Do they think they're going to kind of take over? So I think there's kind of fear around what that means because they don't really kind of understand how it works. And people just don't really know what it means. What does co-design? What is co-production? What does it mean? And I think that's just about us probably trying to, again, articulate and communicate the benefits and how this works and show how ultimately it's how you get a better service. I've said it before again, the language barrier, huge problem again. We're still doing that in the NHS. I mean, even if you go walk into a hospital signage, I don't even know what any of, what those words mean. So we have to make sure that we're using the language of the patient and not our own kind of internal language. Resistance to change. So, I used to get very angry about this, but I think it's born out of fear. And that's fear because of the catastrophic mistakes that we've made in the past. And it's just people just so reluctant to take a risk and take a chance and do new ways of working. And I understand that. But again, it's just about us picking away, showing it, proving it, having the evidence that this way of working works. And then implementation, I guess, is about sustainability. So we're doing all these great things, but actually who owns it and who's making sure that we're doing it. And it's not just in one small pocket here, it's kind of that everyone's doing it, and because that's the only way it's going to work. Oh, sorry, hang on, yeah. Okay, the good news, yay, because there is some good news. So there's a huge amount of innovation and investment into this way of working. So NHS England have invested a lot of money. You've probably heard about these NHS testbed projects, Vanguard projects, innovation accelerators, particularly in mental health. There's some really, really interesting work. So if you want to read more about it, I won't go into it now, but Google it. I myself am involved in this. We've set up a digital health design network. So that's a bunch of like-minded people across the NHS doing digital health design stuff, coming together, sharing best practice, and then working together on a set of principles that we can all work by. And actually, my program, we're designing this kind of guide, kind of toolkit for commissioners and designers of digital health services, and we'll be including those principles. So what the guide will say is, like, if this is why you need to be working in this way, these are the benefits, so showing them the levers and the cost savings. This is how you do it. Here's some great examples of people who are already doing it. So that's kind of solving the problem of making sure that the expertise is kind of is there locally and with commissioners. And who'd known agile working is now becoming a standard way of working, particularly, well, at NHS Digital. And as I was saying earlier, you can't move for the bunting and the post-it notes. So yeah, so for me, it's kind of evident every day, and I can see that there is a change and a transformation happening. So if you want to read more, you can follow these blogs. So medium.com is where Good Things Foundation are blogging about the work they're doing on the Digital Inclusion Pathfinders. Transformation is our one, so you can see actually what's happening, not just in widening participation, but all of the stuff that we're doing at NHS Digital. You can follow my Twitter. There's some things around, a lot of things around cats in there. So, but if you wade through that, there is some good stuff. Good Things Foundation, and that's our hashtag NHSWDP. Unfortunately, I'm not going to be around for the panel session this afternoon, so I can answer some questions now, or I'm going to be around for the coffee break if people want to talk. Okay? Applause. Applause.
Thank you very much, Nicola. That was great. Are you working with Carol Burks?
Yes.
Yeah. So she was a speaker at this conference last year.
She did. She mentioned that. Yeah. She was probably much better than me.
No. But it's just nice to have that continuity. So that was really fascinating. Does anyone have any questions to kick us off? Yes.
I totally agree. I do. I agree. I think there's so much information out there, and you know, we've talked to people. We've talked to young people. We've talked to a lot of people about how they search for health information, where they start, how they decide what they pick. So the one thing is, and this is really only what I know, is that people are looking for trusted information, clinically proven information, and the NHS.uk, NHS Choices website is a place that people go to. And people, you know, I know people slag off the NHS a lot, but actually, you know, the information is robust and tested and all clinically signed off. And even like we were talking to like 12, 13-year-olds, and they got that this was the place to go for good information. So that's what I would say. Go to places that you know information has some kind of clinical, you know, sign off. Yeah, so for some reason the NHS brand is trusted. But, you know, I know that there's people out there, you know, landing on lots of different sites, but unfortunately we can't control that. Sorry,
okay.
Is that right?
Okay. Yes, lady here.
So you mentioned the Digital Health Design Network. Is that an outward-facing network that collaborates sort of across the industry, or
So it's made up of people who are either working in the NHS doing digital design stuff, or external organisations who are helping NHS organisations do that as well. So it's a small kind of network at the moment, but what we're going to do is we're going to kind of start spreading out. We've literally just started, and we're kind of trying to set up kind of what it is we are and what people want to get out of it, and we'll start then kind of inviting people in, and then, you know, hopefully grow it and develop it.
Love to have a chat with you.
Yeah, definitely.
We work for Torchbox, and we actually work with some NHS.
Okay, brilliant, fantastic. Let's chat. Okay.
Yes.
Ask if you could talk a little bit more about what the co-design process looks like for you, and especially like working with people in the community to help design things that may not be coming from the same point of view of you know, questioning their assumptions and everything. We've got a certain way of thinking about things and trying not to think that we know everything and opening things up so people might come with.
Sure. So Good Things Foundation are the organisation that are leading on those kind of co-design sessions. I'm not a design expert. I'm here kind of representing us, so I'm not sure that I'm the best person to come and talk about the process. I guess if you want, I would be very happy to introduce you to the guys at Good Things Foundation. They'd be able to kind of. Oh, and actually, there is some really great. Because we've been reporting about all of the outcomes from the design sessions that we've been doing, all the process and outputs we've got online. So I'll be able to kind of connect you to them and maybe introduce you to those guys, because they're the ones that are leading it, facilitating it, doing it. So I think I might do them an injustice if I was to clumsily start trying to describe that.
After the coffee break as well, we're going to be getting much more into the sort of tactical implementation around co-design. So hopefully, some of those guys can speak to that end as well.
And also, it's very lengthy as well. I mean, there's a lot involved in it, so I don't know if we've got enough time for me to start here as well.
Anna.
Hiya.
Hey, you're gathering quite a lot of insight, which
Yes.
is really great, and you're doing that with the people who use the NHS as a service, but obviously the healthcare professionals that work within that also are one of those facilitators, are one of those communicators.
Yeah.
Are you actually gathering insight from them and working with
Yeah.
them as well?
So that's really interesting you said that. And actually, that was my fault. I should have mentioned that. So our remit isn't just patients; it's NHS staff as well. And actually, if you think about it, it's so much more important that we're supporting staff first, because if they know about digital, if they've got the confidence and the skill, they're much more likely to engage with it and encourage their patients to use that as well. And actually, we're working with the Royal College of Nurses, who are about to just launch a massive national consultation with nurses around digital. So how they're using it every day, what they want to see improve, you know, what's going to help them. So that's going to be a big, big piece of discovery. And actually, at the end of that, we're going to see what the outcomes from that consultation are. And we're going to take maybe a couple of those barriers and challenges and run a Pathfinder project on the back of that. And we're doing loads of stuff with them. So there's a big campaign called Every Nurse is an e-nurse. So what they're trying to do is build that capability across nurses. But we're going to help them run some pilots using kind of community digital champions, supporting nurses, showing them how to, you know, access and use all of this technology as well. So there is a bunch of stuff happening. Yeah.
I'm sure there are. I'm really sorry. I know there are more questions, but I think we should.
So I'm going to stay for the coffee.
Yeah.
I'll be out and about. So yeah, give us a shout and get in touch. And I'm happy to do that.
Please do grab Nicola in the break. And before we head off coffee break, so it'll be about half an hour. There or thereabouts. We might maybe a little bit shorter because we're running slightly behind. But another round of applause for Nicola Gill. Thank you very much.